Rape is a deeply complex and devastating crime that stems from a mix of psychological, social, cultural, and biological factors. Understanding why rape happens, the psychology behind it, and how to prevent it requires a comprehensive approach. Below, I'll break down the scientific and psychological aspects of rape, the mindset of perpetrators, and strategies for prevention. Why rape happens? Rape is not solely about sexual desire, but is more often driven by a desire for power, control, and domination. Various factors contribute to the occurrence of rape. First up, power and control. Rape is often about asserting dominance and control over the victim. Many perpetrators seek to dominate, humiliate, and dehumanize their victims, gaining a sense of power from the act. Second, cultural and social norms. Societal beliefs that promote toxic masculinity, entitlement, and gender inequality can fuel rape culture. In societies where women are objectified or seen as inferior, men may feel more entitled to exert control over them sexually. Rape myths, such as women secretly enjoy being overpowered, or if a woman is dressed provocatively, she is asking for it, perpetuate dangerous attitudes toward consent and sexual violence. 3. Psychopathology and personality disorders. Some rapists may have underlying antisocial personality traits, such as a lack of empathy, impulsivity, or a disregard for others' rights. However, most rapists do not meet the clinical criteria for psychopathy. Narcissism and entitlement are also common traits, with many rapists believing that they deserve sex or have a right to dominate others. Fourth, sexual violence as a learned behavior. Exposure to violence in childhood, either as a victim or a witness, can increase the likelihood of committing sexual violence later in life. Early experiences of abuse can normalize aggression and dominance in relationships. Media that portrays sexual violence, objectification, or aggression toward women can contribute to the desensitization of violence, reinforcing harmful behaviors. Fifth, peer influence and group dynamics. In certain situations, group dynamics can play a role, such as in gang rapes, where groupthink and peer pressure may lead individuals to act in ways they wouldn't alone. In male-dominated groups, such as fraternities or military units, hypermasculinity and a culture of proving manhood can also contribute to sexual violence. And lastly, sexual gratification and opportunism. While less common, some rapists are motivated by pure sexual gratification and take advantage of situations where they believe they can rape without facing consequences. In these cases, impulsivity or intoxication, like alcohol or drug use, may play a role, where the individual acts on opportunistic urges. The psychology of rapists. Rapists may exhibit a range of psychological traits, motivations, and behaviors. Research has identified several psychological patterns. First up, lack of empathy. Many rapists lack the ability to understand or care about the pain and suffering they inflict on their victims. This emotional detachment allows them to commit violent acts without feeling guilt or remorse. Second, sense of entitlement. Some rapists feel that they are entitled to sex and that their desires outweigh the victim's rights or autonomy. This entitlement is often bolstered by societal attitudes that objectify women or normalize aggression in men. Third, anger and hostility. In some cases, rape is an act of anger and revenge, directed at the victim or at women in general. These individuals may harbor deep-seated resentment toward women and use sexual violence as a way to express their rage. Fourth, sadistic pleasure. Some rapists derive sadistic pleasure from the act, finding gratification in their victim's suffering. This can be linked to sexual sadism disorder, where sexual arousal is tied to the physical or emotional harm of others. Lastly, remorse in rapists. Not all rapists feel remorse. Those with antisocial personality traits may never experience guilt or regret for their actions. However, some individuals may feel remorse, often after being caught, but this is typically self-centered remorse, meaning they regret the consequences for themselves rather than the harm inflicted on the victim. Genuine remorse is rare, especially among serial or habitual offenders. Many rapists rationalize their behavior, downplay the severity, or blame the victim for their actions. How can we prevent rapes? Prevention strategies need to focus on both individual and societal changes. A multi-pronged approach that targets education, policy, and cultural attitudes is crucial. First up, comprehensive sexual education. Consent education should be a cornerstone of sexual education, emphasizing that sexual activity must be mutual, voluntary, and respectful. Early education about gender equality and respect for others' autonomy is key in shaping attitudes from a young age. Second, challenging rape myths and cultural norms is crucial. Media, schools, and communities must challenge the myths that justify rape and work to dismantle rape culture. This includes addressing toxic masculinity and promoting healthy masculinity. Public awareness campaigns that focus on respecting boundaries and understanding the consequences of sexual violence can shift societal attitudes. Third, empowering bystanders is another important step. Programs that teach people to recognize signs of potential sexual violence and to intervene safely, like bystander intervention, have been effective in preventing rapes in certain environments, such as college campuses. Fourth, law enforcement and legal reforms. Strengthening the legal framework for prosecuting rapists and improving victim support services are crucial. Many rape cases go unreported due to the fear of not being believed or of facing victim blaming in the legal process. Improving conviction rates and ensuring that rapists face meaningful consequences can act as a deterrent. Fifth, addressing childhood trauma and violence. Early intervention programs for children exposed to violence or abuse can reduce the likelihood of them becoming perpetrators of violence later in life. Offering counseling, support, and rehabilitation for at-risk youth can break the cycle of violence. Sixth, mental health support for at-risk individuals. Providing mental health services to individuals who exhibit signs of anger, hostility, or lack of empathy toward others can potentially prevent future acts of violence. Programs focused on anger management, empathy training, and impulse control have been shown to reduce the risk of sexual violence in some individuals. And lastly, alcohol and drug regulation in social settings. Many rapes occur when one or both parties are under the influence of alcohol or drugs. Stricter regulations and education about responsible alcohol consumption, especially in environments where sexual violence is more likely, like parties and bars, can help reduce opportunistic rapes.